antibiotic resistance is absolutely on the rise. And before we had antibiotics, 43% of people died of infection. At the moment, only 7% in Europe and this country. And that is set to rise unless we find new antibiotics.
A lot of effort that addresses the fundamental issues of discovery and development. We're seeing collaborative research projects that are producing new insights. And in terms of development, we've seen the recent release of some very exciting guidelines from the European Medicines Agency that will facilitate the development of drugs in settings of high unmet need. So that's one big area. The other area is that we're just now beginning to tackle, I think, in a very forthright fashion, the challenge of antibiotic business models. We really do have to rethink the approach to antibiotics. What's an antibiotic worth? What is good antibiotic stewardship? How should we reward innovation in this area? And I think if we can tackle that set of questions, in addition to the discovery and development pieces, we're actually going to be creating the foundation that will allow us to bring forward new antibiotics. We desperately need to create them, and I think we can by getting started now.
We know that antimicrobial resistance that we create in animals when we use antimicrobials will move to humans and result in some way, at some level, it will result in problems treating humans, and in some cases, humans losing their lives.
For most of my life, we've been in a very safe environment where antibiotics have protected us. Unfortunately, that isn't the case anymore. There's resistance occurring throughout the world. And this now, to me, is one of the biggest issues. We go into hospital, we expect to get treated effectively by drugs or even not to require drugs. This might be the case in 5 to 10 years' time. We need new drugs now.
With the changes that there have been in the pharmaceutical industry, even those companies that have stayed involved in antimicrobial research are doing less early stage research in common with other therapeutic areas. That's opened up a gap between large pharma and very small biotech and academia, where a lot of early stage research surfaces. Redex is positioned in that gap to work with both parties to understand the needs and wants of large pharma so that we can deliver programs to them that they're prepared to license, but also to work with biotech and academia to inform our own science to make sure that we're producing the cutting edge therapies that our staff are working on.
There are a number of things we've got to do. The first is we've got to look after the antibiotics we've got. And that, some people call it stewardship, conservation, but that means thinking about when we use them, stopping them if they're the wrong ones, not using them in the community for viral illnesses. We've also got to make sure that they're not overused in the animal sector, and that is a big issue worldwide. But one of the big problems is, of course, it's not a good pipeline of new antibiotics. And in the past, we were rescued by new antibiotics. So we've got to find a way to incentivize the research and then development of new antibiotics and anti-infectives.